Hi everyone, this is Dr. Farida Rajan Ibrahim Omasundi. If you haven't yet subscribed to my YouTube channel, please do so. Today, I just want us to talk about vaginal fungal infections. You know, this is also a very important topic. So, what are vaginal infections? Vaginal fungal infections are also called vaginal candidiasis or yeast infections, which will be caused mainly by an overgrowth of fungi, which is primarily Candida albicans, and this will disrupt the normal vaginal flora, leading to conditions or symptoms such as irritation. They can be discharge as well as itching. So mostly this condition affects women of reproductive age because there is mostly hormonal influence, and about 40 to 50% experience recurrent infections, and about 75% of women experience these vaginal fungal infections at least once in their lifetime. So having said that, what then are the causes and risk factors? So there are various conditions that can alter hormonal function. So we can have things such as pregnancy, menopause, or the use of oral contraceptives that can alter the normal hormonal function, leading to vaginal fungal infections. Yeah, so those are just some of the conditions that can do so. And sometimes you find that there's a weakened immune system in cases where there's uncontrolled diabetes mellitus, or sometimes there's the use of immunosuppressive therapy such as corticosteroids can also lead to these vaginal infections. And sometimes, you know, there's weakened immune system in HIV/AIDS patients, so those are also predisposed to having vaginal fungal infections. There are various lifestyle and environmental factors that can cause this condition. You know, wearing tight, non-breathable clothing is one of those. Having poor hygiene or excessive dodging. Also, high sugar diet will support fungal growth. The use of antibiotics also disrupt normal vaginal flora, which can ultimately lead to vaginal fungal infections to occur. So there are also various things that can lead to this condition, such as the use of spermicides and lubricants. These will ultimately alter vaginal flora, and in cases where there is a sexual transmission occurring, that can also have an impact, leading to vaginal fungal infections. Yeah, so those are just some of the things on sexual activity. So what then are the symptoms? Mostly there is pain and discomfort, especially during intercourse. This is what we refer to as dyspareunia. There can be redness and swelling of the vulva. You know, there is burning sensation, especially during urination, or there can also be burning sensation during intercourse. And there is itching and irritation of the vulva and vagina. Sometimes there is also thick white cottage cheese like vaginal discharge which may occur, and this is mostly in most cases odorless. Yeah, so those are just some of the symptoms that can the patient can present with to the hospital. Yeah. So what then are the complications? You know, there are various complications that may occur, such as the spread of infection, especially in immunocompromised patients. And they can also be secondary bacterial infections due to scratching, and they can be chronic or recurring infections that can occur in this condition. So that was just a brief overview on vaginal fungal infections. And if you haven't yet subscribed, make sure you subscribe so that you don't miss out on any interesting content every time I post. Thank you.